you should definitely try to visit a gynecologist before trying for a pregnancy, because there are many medicines that we need to advise you to start before you start trying for a pregnancy. Hi everyone, I am Dr. Vaishali Sharma, consultant gynecologist, laparoscopic surgeon and infertility specialist. When do you need to visit a gynecologist? Most of the times, the patients come to us when they are pregnant or when they are trying for pregnancy but they are unable to get conception. But there are many other things when you need to visit a gynecologist. सबसे पहले, the most important thing I want to stress upon is that अगर आपको कोई भी menstrual irregularity है, if you think that there is some change in the cycle pattern, there is some change in the bleeding pattern, or if there is sudden increase in the pain that you had been experiencing during the cycle, then you should definitely visit a gynecologist. Similarly, if you find that there is some abnormal discharge or if some abdominal pain is there or foul smell is there, then also you should not neglect your symptoms. You should definitely visit your nearby clinic as soon as possible. Many a times patients, they reach a doctor's clinic only when pregnancy is there. But I would like to say that you should definitely try to visit a gynecologist before trying for a pregnancy, because there are many medicines that we need to advise you before you start trying for a pregnancy. Like folic acid has to be started before you start trying for a pregnancy, because if there is a deficiency of vitamin in your body and you are conceiving in such a situation, then the baby that may be formed may not be normal. There is a high probability that there may be some anatomical abnormality in the baby, and which we may come to know later on during a pregnancy. So it is always advisable to visit your nearby gynecologist before you start trying for a pregnancy. Get yourself checked with all the blood tests, with ultrasound, and start all the medicines that have been advised to you before trying for the pregnancy. This thing also ensures that if there is something wrong, like thyroid abnormality is there, or if the sugars are high, or if there is any other infection is there, all these things can be taken care of before you conceive. Because if once the pregnancy is there, then it really becomes difficult to give you the treatment or to start on the medicines or antibiotics. So it is always good that you visit the clinic before the pregnancy is there, so that your body is actually ready for the baby. Next most important condition in which you should definitely visit a gynecologist is if you are postmenopausal. That means you have achieved menopause, there has been no bleeding for the last 1 year, and you have not had your cycle for the last 1 year, and again the spotting is seen, or if bleeding is there. In that condition, don't miss out on that thing. That is a very important symptom that is called as postmenopausal spotting or bleeding, and we need to really rule out that there is any malignancy. If it is there, we need to find out the cause of that bleeding and we need to treat it at the earliest. Similarly, there are certain other alarming things that you should be aware of. One is postcoital bleeding, another is intermenstrual bleeding, that is the spotting between your period cycles, and post-menopausal bleeding. This way, if you feel that there is some abnormal bleeding or abnormal discharge, or there is some severe pain in the abdomen which was not there earlier, then don't miss out that thing. You should definitely visit your nearby clinic. Coming to the routine health checkup, I would say as you are getting your blood test done, as you are getting your health checkup done regularly on annual basis. Similarly, gynec annual health checkup is also very important, especially in the females who have had their kids. Many a times they don't visit a gynecologist once they had their kids, and then they usually come in their postmenopausal state when they are found with some abnormality, some problem like ovarian cyst or something abnormal is there already. So you can find out the reason, so you can cure that thing, you can prevent that thing from happening, and definitely come for a routine gynae checkup in which routine pap smear is done. In this, we take out the secretions which are present at the mouth of the uterus and we send them to the lab to detect any abnormal cells there. And at the same setting, we are doing the ultrasound. It is done transvaginally and it gives us a closer view of the uterus and both the ovaries, if there is any fibroid, if there is any ovarian cyst, whatever is, if there is any abnormality, it can be detected at the earliest so that treatment can be initiated as early as possible and there is no complication in the future. So thanks a lot. Take care of your well-being, and you can leave your queries in the comment section. We will be really delighted to help you out. Thank you. Take care. Bye.